Hi, we're going to talk today about butt augmentation. Butt augmentation is a surgical procedure which is used to make your butt a tiny bit bigger, but mainly perkier. Of course, if your frame allows, you can have quite a bit of increase in size, but the only reason we are here today to discuss one fundamental option. Where do I put my implant? Because that will dictate, one, how natural it'll look, how long it'll last. For example, people put implants a lot in front of the gluteal muscle, just under the skin. Fine, if you're really heavy and you have a lot of padding, it hides it for a while, not forever. Eventually, these implants will move, and of course, it can be felt, so it's not really a great place to place an implant. The other alternative, and people have done it in the past, is where they put it totally behind the gluteal muscle. The problem with that is there's a very important nerve called the sciatic nerve, and that comes out, and you have to watch for it. So you cannot really use quite a big implant because it can compress it, and that'll cause you a lot of problems. So the best place to put an implant is actually inside the muscle. That's a technique that is probably the one that will give you best results from a natural perspective, but it's limited by the volume or the size of your muscle, because you can't put a huge implant in a small muscle. So your frame will dictate how far can we push it. But the advantage to that technique is, one, it's totally hidden, it looks perfectly natural, it cannot be felt, it doesn't move, and most importantly, it does not affect the nerve that we spoke about, the sciatic nerve. So that's the main way of augmenting the butt, with implants. Of course, there are other things to consider when you're doing butt augmentation, and one of them is transferring fat, or called the Brazilian. And the Brazilian butt lift is where basically you harvest fat from somewhere else and you transfer it to the butt. Always remember, I cannot make people Kim Kardashian, because that's not what everybody can get. Genetics play a big part of your frame, and that dictates mainly the outcome. So we can put an implant to give us projection and firmness of the butt, but we can also put fat. Another thing to consider is actually your waist. And a lot of people have a little bit of love handles, or what we call flanks, and taking them away with a little bit of liposuction during the procedure is quite advisable, because it gives you a nice curvy inverted heart-shaped butt, which most women desire. If you have any questions, please contact us. Thank you very much.